Listen to your gut. So if you're not comfortable doing a treatment, even if you're, let's say you're a little nervous, you come, you sit on the seat, you had your consultation, you still don't feel comfortable, don't go through with it.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. Now today I have Panteha Partovi from Santosha Aesthetics. She did her undergraduate at UC Berkeley and received her graduate degree from Loma Linda University. She then became a physician assistant due to the versatility of the field and is currently a multi-specialty medical provider with professional experience in primary care, medical aesthetics, and psychiatry. She started Santosha Aesthetics before she turned 30 with a colleague and with only $5,000 and slowly grew it to what it is now. So, Panteha, glad to have you here.
Hi, thank you for having me.
So let's dive right into it. I'm curious, how did you first get interested in aesthetics?
It is the art of the practice. So growing up, I always was a very creative child. I remember I used to make clothes for my Barbies from like felt. I don't know, it's like from like Michael's or Joann's, like these like felt sheets, and I used to make clothes from scratch. I was gifted a sewing machine from my parents when I was 14. I was self-taught in like art and painting when I was 15 or 16. I just kept wanting to create, and that's what always gave me a lot of joy. When I was younger, I used art as a medium for expression. So it was a lot of like being able to express myself and be able to heal as well. So then growing up and then deciding to go into the medical field, medical aesthetics was something that I could do, where I could merge my passion for biology, my passion for science and medicine with my creativity and my passion to create and grow.
Got it. Nice. Now, can you discuss some of the most popular treatments that your patients come to you for, and also why you think they're the most popular?
So I would say hands down, the most popular treatment is neurotoxin treatments, which is everyone knows as Botox. There's Botox, Dysport, Jeuveau. The newest one now is Daxxify. This is an entry level to aesthetics because one, it addresses an issue that everybody has, which is fine lines and wrinkles. Whether we like it or not, as we age, we are going to develop fine creases where we have muscle movement. So the most popular places are going to be around our eyes, crow's feet, 11 lines, which is the frown line, forehead, but we could do all these different other things with it in our face. But that's entry level because one, it serves everybody can make use of it, but also it's very, very non-invasive, and it's not very, I would say, scary for someone who is very naive or very new to the world of aesthetics. It's something that requires very little downtime, minimal discomfort, doesn't take too long to inject. The treatment doesn't take too long, and the effects don't stay for very long. The effects stay anywhere from 3 months, 4 months, with Daxxify in the market, maybe up to 6 months. So it's something that isn't very intimidating for first timers. So
now, are there any emerging treatments that you're particularly excited about that's coming out on the market?
There's always new emerging treatments coming out of the market. I always tell people, people are always like, oh, when was the last time you trained? Or when was the last time you did this or that? I'm always in training. I'm always learning about new things, webinars, hands-on treatments, trainings, all that stuff. I think the things that I'm most excited about, it's so hard. I'm excited about everything. So regenerative medicine is one of them. So basically things that use what we already know about cells and what we already know about cellular regeneration, and being able to use that now in the aesthetic field to help with skin rejuvenation or help with hair regrowth by just pushing our cells to renew themselves and to go through the process of neocollagenesis or anything else that helps with laxity of the skin, which happens with aging and as we get older, and anything else, fine lines, large pores, I would say acne scars, anything like that, you're regenerating the skin to make new cells. And I think that's really cool because it also is something that is a little bit more, I would say, natural, where we're using things like PRP, or we're using things like exosome, which is stem cell particles, to help regenerate what we already have. So it's something that kind of brings in also a new market as well.
Yeah, and that's a very big differentiator in practices. I'm starting to see a little bit more medical spas bringing on regenerative medicine because it's the new wave, and it definitely makes your typical med spa stand out. Now that kind of leads me into my next question, as far as I want to talk about what really differentiates your practice from others in the industry. And I actually want to start off with the name Santosha. How did you come up with that name?
Yeah, so I came up with this name. It actually came to me. I practice yoga. I used to practice more than I do now, but I was in my practice and we were doing some type of move or something, but the yoga instructor, he was reciting some poems, and then he said Santosha. And I was like, wow, that's beautiful. And he went on to explaining what it means. And Santosha in Sanskrit, which is, it's an Arabic language, it's an old yogic language. In Sanskrit, it means to find contentment within yourself. And I thought that was very, very cool because it was very aligned with some of the reasons why I wanted to go into medical aesthetics. And it was right around the time when I was thinking about going into this field and opening a practice. So it seems like an oxymoron. And for me, that was the reason I wanted to go into it, because I wanted to be able to blend those two worlds of okay, you're in this box that you get invasive or non-invasive work done, whether it's plastic surgery or non-invasive, but you're in this box, and that means that all you care about is your looks, or you're superficial, or that everyone's going to know, or that you look fake. But then you're also in this box where you really care about preserving yourself, or you care about like rejuvenation, like things like that. And you want to be able to take care of yourself in a way where it's healthy, where you're looking at yourself as, wow, I'm really confident. Like I can, this confidence opens doors for me. This confidence makes me feel rejuvenated and refreshed, and allows me to, show up with my best foot forward, basically, without having to kind of bank on a complex, or wanting to look like the next trend, or wanting to look like the next, Instagram person, or reality TV star, anything like that, basically. So it was kind of something that it just fit what I wanted to do for people, which is, yes, you can get work done. It's called self-care. And no, you don't have to lose yourself within that or want to be something that you're not.
Okay, got it. So it's a very unique way of approaching it. And actually that kind of goes into like another way that you approach your relationship with your patients, also a very unique way. We were talking about this before, but you introduce the concept of play into the practice, in particular, how it kind of breaks down that very stuffy relationship between the medical professional and the patient. So could you talk a little bit more about that as well?
So if you know me personally, I always say I'm a child at heart. And so that kind of flows with this idea of being playful and remembering how to play. And so for me, it's the way that I address my patients is, I walk in, I talk to you like a friend. I ask you about what you do and your family, and just kind of like a conversation back and forth. And I get to know you, and I get to know your values. And for me, that also helps me when I'm trying to come up with your aesthetic plan. When you're, so when my patient, when I'm getting to know them on a different level, on a level that is a little bit less, I call it stuffy, then I'm able to say, oh, okay, this person's kind of like this, and they're asking for this, and maybe this suggestion would work better for them. So I feel like I can just be a better provider for them. Also, they feel, or I'm a little bit more relatable to them, because it's not just, this person, medical provider in a white coat that has this education and, is in this office in Beverly Hills. And, it just kind of brings down the level, the so many different levels of separation, and kind of brings the individual a bit closer so that they feel more comfortable being able to share with me, what they need, what they want, that sort of thing.
Now, you're also more of a boutique practice. So a lot more of that individual care, the individual attention, which I think goes a lot into your concept of play. But could you also talk a little bit more about kind of why you want to position yourself more as that boutique practice?
Yeah. So the boutique practice basically means it's, we're a small business. Right now, I'm the only injector, which I really do appreciate. I mean, the time where there will be more injectors, but the idea of a boutique practice is that when you come in, you know what you're getting, you know who's injecting you, and whatever conversations you've had, those things are going to be remembered for the next time and the next time. And your treatments will be layered, and your needs and wants will also be layered, because it's not like you're starting fresh every time and you have to explain your history again and you have to do that sort of thing. It also just makes me feel a little bit more comfortable as well, because I'm able to remember more patients, and I'm able to get to know them, over a long period of time, just follow them through their journey. So yeah.
Okay, got it. Thank you for sharing. Now, I'm curious, how do you approach educating your patients about the services you offer and the benefits? I'm sure you get some people come in, they're not quite sure what they're looking for, and so you have to kind of educate them and guide them on really what really fits their situation and what the benefits of that. So can you talk a little bit more about your approach when it comes to that?
So that also ties into being a boutique practice. So I spend a lot more time. I'm able to spend more time instead of, having to be on a strict regimen or guideline of how much time I can spend with the patient. But basically, I have a few different types of patients. So I have the patient who knows exactly what they want, and they've had, they've been in the aesthetic world for a while, and that's a little bit different. I walk in and I realize this, within the first 5 to 10 seconds that I'm in the room, that, okay, this patient knows a little bit more about what they want. They're more comfortable with aesthetics. And so I'm able, in my treatment and my recommendations for them, not my treatment, I'm sorry, in my recommendations for them, I am able to incorporate the things that they're saying or wanting more, versus if I walk in and somebody is very new and doesn't know much and maybe gets, feels a little bit scared, then I change my style, because I'm able to feel that, okay, this person maybe needs a little bit more hand holding. So actually let me explain a little bit more, let me make sure that they feel comfortable, which is really important. So then maybe in my explanation, my style will change a little bit, where I'm talking a little bit more about, well, how are they going to feel? How's it going to feel during the process, right after the process? How is it going to be compared to, let's say, something else that may be a little bit longer of a downtime versus, less long of a downtime? So it really just does depend on, when I walk into the room, like the feeling that I get from the individual. So I can't say my style is, I have a particular style for all of the clients that come in. It really is just based on, what I get out of them when I walk into the room for the first time with them, and just, how the conversation flows and how I feel that their nerves have changed, if they're continuing to be nervous throughout the appointment, or if they've kind of, or maybe a little bit on defense, or they've kind of just relaxed and their body language kind of relaxed, and they're more able to hear about the treatments, or all different types of things, and I'm able to also share a little bit more.
Got it. Now, I'm sure that even as you're going through this process of sharing, there's a lot of misconceptions that people have about the treatments that you offer. What are some of the most common misconceptions that you hear most from your patients?
So I can answer that question with fillers. The misconception there is that if you get fillers, it'll be very obvious, or at some point they will migrate, or kind of have some kind of adverse effect. More particularly, actually, I want to get into lip fillers. So lip fillers, and I know by experience, you can definitely get lip fillers done without anybody knowing, not even your partner that you go home to that day. And I'm saying I know by experience, because I've treated a lot of my patients who I see them, 2 weeks later, 3 weeks later, and they came in for something else. And I was like, oh yeah, I forgot we did lip fillers for you 3 weeks ago. They'll be like, wow, I'm really happy with my lips. I'm like, oh my God, I totally forgot I did it for you 3 weeks ago. But yeah, I see it. It's on your chart. I did it for you. And so it's, again, it's going back to finding contentment within yourself. It's going back to Santosha. It's going back to that happy middle. It's like you can get these things done without it being very obvious and with you still looking like yourself. It's just like yourself 2.0. Yourself rejuvenated, yourself refreshed, yourself with more sleep, yourself with less anxiety and stress.
Okay, got it. Now, I'm sure that you may get some people that come in, and if you could explain this from kind of in your own words, what is the biggest difference between what a medical spa does in their treatments and what your traditional cosmetic surgery does in their treatments? Kind of what's the best fit for any specific person?
So, like a cosmetic surgeon is going to be a surgery, it's going to be invasive, and there is going to be general anesthesia involved, which means that you are completely out, you put asleep. And so that's something where downtime is much longer, and the effects are also going to be much more noticeable. So somebody who, someone who is thinking about cosmetic surgery sometimes does end up just doing, let's say layering treatments, like they'll do like lasers and some Botox and fillers and they'll be happy for a while. But I can never compare that, apples to apples, because it's going to be a different level of treatment.
Okay, so it's basically the plastic surgery side it's a much more serious, involved, invasive treatment for someone who maybe needs that or is okay with the drawbacks of that, versus the medical spa is more of the less downtime, less invasive. And if you're kind of looking for maybe some small changes here and there, you'd be a little bit better fit. Would you say that that's relatively accurate?
Exactly. Better fit for smaller changes. So I would never, say to someone, yeah, come get Botox and fillers and you're gonna be just as happy as if you went and got a facelift. It's not the same, right? So if you get a facelift, you're gonna see the results way more and you may be happier if you need it than if you came and just got Botox and fillers.
Okay, got it. Now I want to switch over to your patients. How would you say that you balance providing that relaxing experience for your patients when they come for a treatment, but also making sure that their safety and well-being are taken into account?
So medical history is very important. So every patient that requests a consultation with us, they have to fill out a form. And within the form, we ask basic medical history, social history, if they have done any kind of treatments before. But there's certain things that I'm looking for that would be absolute no's or red flags that I wouldn't move forward with, not all of the product or not all the services that I offer, but I wouldn't move forward with some of the services. So I'm looking for people who, let's say, have, autoimmune disorders, people who have autoimmune disorders that are not controlled, flare-ups. I'm looking for individuals who have had recent infections where they've required antibiotics or they're getting over anything where their immune system is down. I'm looking for pregnancy, obviously, breastfeeding, and the certain types of medication. So we ask all these things just to make sure that the patient is safe with the treatments. Now, we can never guarantee anything. There's always going to be risks, always. Yeah. And that's something that we also make sure the patient understands, whether, and they understand, and that would be what we use to move forward with the treatments.
Now, this next question, I'm very curious about what your answer would be, because when people think about medicine, they think it's a very scientific, step-by-step process. But what would you say, what role does creativity play in the way that you approach the care for your patients?
So medicine is very step-by-step. And I would say within medical aesthetics, there are things that we are still doing in a very step-by-step approach. Let's say, managing adverse effects or, outcomes that aren't desirable. Now, the aesthetics part is what brings the creativity in there. And this is where one size does not fit all, where I'm able to be creative because there isn't a exact step-by-step approach to medical aesthetics. So I'm able to say, hey, you can do this or this. Which one do you feel comfortable with? Okay, let's try this first. Maybe it'll work, maybe it won't. Because I haven't treated the person. I don't know how your skin's going to respond. So there's a lot of that too, where there's less certainty than maybe other fields of medicine. And so that lack of certainty or less certainty could be a good thing or bad thing. actually allows for a little bit more creativity, and allows for the patient to also have a little bit more say in how they want to go about with, the outcome or what they want at the end of the treatment.
Got it. Now, I'm sure that throughout your experience, you've probably had some particularly challenging cases that you've had to work with. You mind sharing just one story of just a tough case that you got, but in the end, you were able to get them a successful result?
Yes. So I had a patient, and she was, I believe, at the time in her late 60s. And this, I'm sharing this because also it was very heartwarming, because she really appreciated the outcome. But she was a woman who was born with a hemangioma on her face. It was congenital, so it's basically this vascular benign tumor. They can come very small, where people have cherry angiomas where they're tiny, and people develop them on their body, sun exposure, things like that. But sometimes it can be very large, and so she had a huge one when she was born. I would say, I think she said about like 5 inches or something like that in diameter. And so she had radiation therapy, surgery, many surgeries, many bouts of radiation as a child and early childhood, throughout her teens. And then as an adult, she had different plastic surgery treatments to help with achieving asymmetry, because what happened at the end was that one side of her face, it was the left side, around her nasal area, her nasal and cheek area, she had asymmetry, she had fat loss. It just looked drooping compared to the other side. So this woman had fillers done, different types of fat graft placements. And so she came to me, and I decided to do thread lifts for her. She's never had thread lifts done before. And this is, post all her other treatments that she tried. And so the reason why I decided thread lifts was because thread lifts reposition fat pads. And I noticed just the style within that left side of her face that she had, it was a little bit more sagging or depressed, that side of the cheek, but she still had good fat pads. So it was very challenging, because I did have to see her over a few times, just because when we're doing thread lifts and when we're, for her case, it was more of a severe case where, I needed to use a lot of suture material. She had a lot of swelling, so we had to do the treatment over a couple sessions. But basically what I was able to do was I was able to reposition her fat pads, and I was able to lift up that cheek and create a more asymmetric look where her cheek was lifted up. And so she didn't have this depressed concavity that she used to have on the left side of her face. And she was really pleased with it. She had tears in her eyes, because she's like, wow, I've done all of these different things, but this was the least downtime, maybe not as invasive as some of the other treatments that she had. And it gave her good results. It gave her lasting results. Obviously, it goes away after a while because they're dissolvable sutures. And so we had to redo the treatment a few times. But that was a case where it was very difficult, but nothing good comes easy. It was a very, it was a very difficult case, but I was happy for her. I was happy that she felt confident. She was like, wow, I can look in the mirror and just actually not just focus on that part, or not kind of figure out, okay, what can I do next to make my face, look more symmetrical.
That's amazing. I mean, I think it's one thing that people don't realize about the aesthetics industry, is that you really change people's lives because they have something either physically or mentally or emotionally, or all of them, that's holding them back. And then when you're able to fix that for them, it just completely turns their life around. So I think people don't really quite realize that when it comes to the aesthetics industry. Where do you think the future of aesthetics is going?
So I think what I brought up earlier about what excites me, I think that aesthetics and functional medicine is merging, and I'm really excited about that. I think that people are looking for regeneration, and I think that's going on with not just aesthetics, but it's going on with pain management, it's going on with ortho and primary care. Just how we look at illness is that, hey, our bodies were meant to heal themselves. So what can we do to enhance that, to continue the healing? So, functional medicine or anti-aging medicine, it's looking at aging as a disease. And so if we're able to really understand how our bodies age, we can try to reverse that. And so there's, lots of burgeoning research and lots of cool things out there right now that really excites me. That's, maybe outside of aesthetics currently right now, but I really do see aesthetic medicine going there.
Now, I have one last question for you, but before I ask it, I want to point people to your website at www.santoshaesthetics.com. Now, the last question is, what would you say is the most important piece of advice you can give to someone who's maybe on the fence about getting some type of aesthetic treatment done, but something's holding them back?
Listen to your gut. So if you're not comfortable doing a treatment, even if you're, let's say you're a little nervous, you come, you sit on the seat, you had your consultation, you still don't feel comfortable, don't go through with it. That's the most important piece of advice I can give you. You have to be at one, you have to be aligned with whatever treatment that you're going to get. Listen to your gut, because it's emotional intelligence, and it's telling you something that maybe logically you can't understand. And it just maybe means that you're not ready for it. Maybe it means the practitioner is not the right fit for you. But it just means that it's not the right time.
Okay, got it. Well, there you have it. Panteha sharing her expertise. Now, Panteha, where can people contact you in your practice?
So you shared our website. We have a booking link there. We have an Instagram, Santosha Aesthetics. And you can also call us, 310-740-9373. What else? Yeah, those are the best ways.
Okay, great. Well, thanks for being on the show and sharing your message.
Thank you for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.